very good morning everyone. So today's topic is tumors of salivary gland. I will do a short review along with MCQs at the end of discussion. Before I start, this topic is relevant for UPSC CMS students and FMGE students who are appearing for this year's exam, along with the university undergraduate students who are appearing for their university exams. So let us get started with this topic. As you may be knowing, most of the salivary gland tumors are benign tumors, and as you can see from the picture, most of the tumors in the salivary gland region are common in the parotid gland. That is the most common site of salivary gland tumors. The second point to be noted is regarding the frequency of malignant tumors. You can see that in parotid gland, even though the tumors are common, only 10 to 20% is malignant. In submandibular gland, 50% of malignant and 50% of benign. In sublingual gland, you can see a slightly higher percentage, which is 85%. And when you see the minor salivary glands, which are in the upper aerodigestive tract, the frequency of tumors is very rare, but you see the malignancy rate, it is 90%. So you can see that the parotid gland is relatively a bigger gland and a major salivary gland, where the malignancy is less. But the minor salivary glands, the frequency of tumors is less, but whatever tumor occur, there is a high chance that it is malignant. So that is why I have put up in the slide, smaller the salivary gland, higher is the chance of it being a malignant tumor. This is a very important dictum as far as the salivary gland tumors are concerned. We now will look at the classification of the salivary gland tumors. Basically, there are two classifications. One is the adenoma and the carcinoma. Adenomas are the benign tumors and carcinomas are the malignant tumors. Both of them correspond to the category of epithelial tumors. Okay, this is a major category of tumors in the salivary gland: epithelial tumors, benign and malignant. Benign is adenoma and malignant is carcinoma. And the other salivary gland tumors are just for you to remember the names alone. They are not very important, which include the non-epithelial tumors of hemangioma and lymphangioma, lymphomas, secondary tumors, the metastatic tumors, unclassified tumors, and the tumor-like lesions like salivary gland, cystic lesions. Out of this, as I told before, the two main categories are adenomas and carcinomas. Always remember, benign tumors are far more common compared to malignant tumors. And the two classical examples of the benign tumors, as you can see from the list, are pleomorphic adenoma and WARTHIN'S tumor, which we will discuss in detail. And the two important carcinomas which I will be discussing are MUCOEPIDERMOID carcinoma and ADENOID cystic carcinoma. Now, going to the one-liners which are usually asked in this particular section of salivary gland tumors, please remember that the overall most common benign tumor is pleomorphic adenoma. We will do a discussion about this pleomorphic adenoma in a while. Just telling you the fact as one-liners. And the most common malignant tumor in the parotid region is MUCOEPIDERMOID carcinoma, whereas in submandibular and salivary glands, it is adenoid cystic carcinoma. This is the general rule. Only one exception comes here in childhood. If they ask you what is the most common tumor of the salivary gland in childhood, which by itself is relatively rare, please remember, in childhood it is hemangioma. It is hemangioma. Even though salivary gland tumors are relatively rare in childhood, if at all occurs, it is usually a hemangioma. These are the usual one-liners which are asked in this salivary gland tumor section. Now I will tell you about some salient points about this pleomorphic adenoma. As you can see, this is called as a mixed tumor. Why this is called as mixed tumor? Because it contains mixture of tissues. For example, it contains myoepithelial tissue as well as the mesenchymal tissues. This is for this reason it is also called as a mixed tumor. And please recollect, pleomorphic adenoma is the most common benign tumor, and the usual location is in the parotid gland. In the parotid gland, it is the superficial portion of the parotid gland which is affected, and the most common location, as you can see in the picture, is parotid tail of the parotid. Okay, as you can expect from a benign tumor, it's a encapsulated lesion, but here is a very important point which should be noted, that it has got something called pseudopodia. Pseudopodia are something like a small finger-like or foot-like extensions which goes out from the main tumor of adenoma. Why this pseudopodia is very important for you to know is because these are all extensions which are going outside the adenoma, right? So what happens is that you cannot do a complete enucleation of this tumor, and if you try to do an enucleation of the tumor, it won't be completely removed, so there is a high chance of recurrence. This is for this particular reason, pleomorphic adenoma should never be enucleated. The only possibility is removal of the portion of the involved portion of the parotid gland, which is what we call it as superficial parotidectomy. So please remember, enucleation should be avoided in case of pleomorphic adenoma. The reason being, it has got pseudopod. Okay, that is the reason why enucleation should never be done in case of pleomorphic adenomas. Right. So what are the usual clinical features? It's a swelling in the parotid region, right? So the classical features are the earlobe will be lifted. Second is there would be obliteration of a retromandibular groove. These are the two important findings which will tell you that it's a tumor arising from the parotid region. Very, very important, because this is a benign tumor, facial nerve is usually not affected and you won't see any features of facial nerve paralysis in a patient with pleomorphic adenoma in general. So these are the pointers or clinical features of pleomorphic adenoma, which is the most common benign tumor of the parotid glands. Now, moving on to the next one, that is regarding the management of pleomorphic adenoma. Please remember, the initial modality of choice is ultrasound. Ultrasound tells you that it is a tumor which is arising only from the parotid gland, and number two, it would also aid in taking up the tissue for fine needle aspiration cytology. So please remember, the initial imaging modality of choice is ultrasound. That is the first important point to be noted. And if they ask you what is the diagnostic modality, it is always FNAC, fine needle aspiration cytology. Please do remember this point, that open biopsy is contraindicated in parotid tumors. Why this reason open biopsy is contraindicated? The reason being, if you do open biopsy, there is chance of injury to the facial nerve. Very important point, there is a chance of injury to facial nerve. Second thing is, it can lead to seeding of the tumors into the surrounding area, thereby increasing the risk of recurrence. This is the second point. Third point is, while doing the procedure of open biopsy, there is a chance of parotid fistula. This is for this reason, for these reasons, open biopsy is contraindicated. And if there is a question, what is the usual diagnostic modality of choice, please always choose FNAC. That is a point to be noted. So now itself I have told you two things. Enucleation should not be done in pleomorphic adenoma. Number two, open biopsy also should not be done in case of pleomorphic adenoma. These are two important negative points which are often asked in your MCQs. The next thing is regarding pleomorphic adenomas, regarding something related to risk of malignant transformation. Please remember, pleomorphic adenoma is a benign tumor. The risk of malignant transformation is usually considered to be somewhere around 3 to 5%. However, it should be noted that in case of long-standing pleomorphic adenoma, for example, it is for many years without treated, long-standing pleomorphic adenoma, you can have the malignant transformation of up to 10%. So always remember, it is very important that if you are not doing a correction of pleomorphic adenoma, you have to follow up the patient, because some of them may develop malignant transformation. And what are the indicators for malignant transformation? Very important. First two are two important things. What is that? First is the facial nerve becomes affected. Second is a rapid increase in the size of the swelling. These are two important pointers, common pointers, which will tell you that there may be a possibility of malignant transformation in pleomorphic adenoma. Second thing is, the third thing is regarding induration and or ulceration. I am talking about the skin overlying the swelling shows some induration or ulceration. And fourth important is enlargement of the regional cervical lymph node. All these are indicators of malignant transformation in pleomorphic adenoma. Please remember this very important point, that only few cases develop, but you should be watchful if you are following up a patient with pleomorphic adenoma. We now move on to the next benign tumor, which is WARTHIN'S tumor. Look at the other name of the WARTHIN'S tumor. It is written as papillary cystadenoma lymphomatosum. Okay. Sometimes it is also called as cystadenolymphoma. But please don't get confused by this term. This term is actually a misnomer, because this is not a lymphoma. Number one, this is not a malignancy. So that is why I am telling you this is a misnomer. It is not lymphoma, it is not malignancy. It's a purely a benign tumor, most commonly involving the parotid gland. Okay. Now then, why this name came into picture? This is because of the appearance of the tumor noted in histology. where they found out that in addition to adenomatous lesions, there is also something related to the lymphoid tissues also present in the lesion. That is why they called as cystadenoma lymphomatosum or cystadenolymphoma. One of the embryological reasons is that it is due to trapping of the jugular lymphatic tissues or lymphatic sacs in the parotid. This happens during the time of development, and that is why there is a possibility of lymphoid tissue being present inside the parotid gland region. Okay, so that is why it gets the name as cystadenolymphomatosis. Okay, right. As I said before, this is a pure benign tumor, most commonly involving the parotid gland. In the parotid gland, again, it's a superficial lobe of the parotid which is affected, and it usually affects the lower pole. So quickly recollect, in case of the pleomorphic adenoma, it involves the tail of the parotid, whereas for Warthin's tumor, it usually involves the lower pole of the parotid. These are some things which are often asked in your MCQs. The next thing is regarding some special points regarding this Warthin's tumor. Please remember this association with smoking. This is multiple times asked MCQ question. Second is, can be bilateral in 10% of cases, because when you look at the other parotid gland tumors, they are not usually bilateral. So this presence of bilaterality is a unique feature which is associated with Warthin's tumor. Now remember, I told you it is associated with smoking. So you can now attribute that it is fairly common in males when compared to females. Why should you know this very important point? Males more than females. Why? Because most of the other benign tumors of the parotid are common in females, whereas Warthin's tumor more common in males. You can remember the association with smoking. Okay, right. Now, Warthin's tumor never involves the facial nerve. Very, very important point. Because why this? See, obviously it's a benign tumor, so you're not expecting a facial nerve involvement. I told the same thing for this pleomorphic adenoma also. But the point is, pleomorphic adenoma, if it becomes malignant, it can involve the facial nerve. But Warthin's tumor is not going to have a malignant transformation. So that is why I am emphasizing on this word, never involves the facial nerve. Very, very important point. And one more important MCQ point is, it is characterized by presence of hot spot in technetium-99 per technetiate scan. Why this is very, very important? Because in all the other tumors, okay, there is only a cold spot if you do this per technetiate scan, whereas Warthin tumor alone shows a hot spot. Why this reason of hot spot? It is attributed to increased mitochondrial activity in Warthin's tumor. That is why it shows a hot spot in technetium-99 per technetiate scan. Okay, so these are the salient points about Warthin's tumor. Again, the same thing, FNAC is the diagnostic modality for Warthin tumor, just like for pleomorphic adenoma, and here also the treatment is usually superficial parotidectomy. Right. Next thing to be noted is some of the carcinomas or malignant tumors involving the salivary glands, and as I said, the most common malignant tumor of the parotid is MUCOEPIDERMOID tumors. Please make a note of this. In parotid, it is always MUCOEPIDERMOID tumor. Okay, and the most common etiological factor is considered to be radiation. This is again a very important question. Why? Because they can just like this ask you this question. Radiation as a etiology is implicated in which of the following cancers? Okay, which of the following salivary gland tumors? Okay, it is always MUCOEPIDERMOID tumor. The most common etiology is radiation. Okay, now you can see that as the name itself suggests, there are two important things. One is the muco, which essentially implies that there are mucin producing cells. Second is epidermoid variety of cells are also present. Okay, now the name is self-explanatory, but why you should know it? Because more the epidermoid proportion of cells is present in the MUCOEPIDERMOID tumor, more it is malignant. Or in other words, the aggressiveness of the tumor is decided by the proportion of epidermoid cells in that tumor. Okay, so more epidermoid tumors, more malignant or more aggressive tumor. This is something which is histologically important and can be asked in your exam. What is the other salient point about this MUCOEPIDERMOID tumor? It has got lymph node metastasis. What is the lymph node we are talking about? Obviously, it's a cervical lymph node metastasis. Please make a note of this. Okay, right. So, this being a malignant tumor, what do you think should be the treatment which should be given for this patient? Please remember, the treatment is total parotidectomy, and because there is a possibility of lymph node metastasis, you also have to do a radical neck dissection. If there is a significant lymph node involvement, you also have to do radical lymph or neck dissection, radical neck dissection. So remember, it is total parotidectomy along with radical neck dissection is a usual treatment we prefer for mucoepidermoid tumor. So don't forget the special point, it has got a high chance of cervical lymph node metastasis. Now the last topic in this I am going to discuss about is adenoid cystic carcinoma. As I was telling you before, okay, let me finish this point. It is also called as cylindromatous carcinoma because of the arrangement of cells in histology. It's also called as cylindromatous carcinoma. As I was telling you before, this is the most common malignant tumor in submandibular glands as well as sublingual salivary glands. Recollect, the most common malignant tumor is in parotid, it is mucoepidermoid tumor, whereas in submandibular and sublingual glands, it is adenoid cystic carcinoma. Now there are some special features for this particular tumor also, which I have listed as 2 points below. What is that? First is the most important thing. What is that? It has got a high affinity for perineural. Okay, so it spreads along the nerves. Very, very important point. What are the nerves which are affected? As you may be expecting, it is a facial nerve which is affected, but it is not only the facial nerve which is affected, it also involves the mandibular and the maxillary divisions of trigeminal nerve. This is something which is very, very important. Maxillary and mandibular divisions of the trigeminal nerve is also affected in adenoid cystic carcinoma. Last point is important. As a comparison, you can do that. Lymph node metastasis is very, very, very rare, whereas lymph node metastasis is fairly common in the previous malignancy we discussed, that is mucoepidermoid carcinoma. So please remember some important points regarding adenoid cystic carcinoma. Before I wind up the discussion, let me just give you some brief idea about this parotidectomy. You can see that I have written superficial, deep and total, which is a one category. What is this? What is called superficial? Superficial means superficial to the facial nerve, you call it superficial parotidectomy. If you do the dissection deep to the facial nerve, it's called as a deep parotidectomy. Total parotidectomy means where both the superficial and the deep portions of the gland are removed. Always remember this. Traditionally, parotidectomy is in reality a dissection of the facial nerve. So that is why when we study about superficial, deep and all, we always compare it with relation to the facial nerve. When it is above the facial nerve region, it's superficial. When it is below that, it's called deep parotidectomy. That's all. Okay. Then you can see two important things there. What are they? Conservative and radical. So what is this conservative and radical? Generally, conservative parotidectomy is for benign tumors where facial nerve is usually spared. So what happens when you're doing a conservative parotidectomy? You don't injure or you don't remove this facial nerve portion. Okay, that's all. Basically, you are sparing the facial nerve while removing the tumor. Very simple. It's done for benign tumor, which usually do not otherwise involve the facial nerves. Okay, right. Then what is radical parotidectomy? This is for cancers or malignancy where facial nerve can be affected. And so what are you going to do? The nerve is excised in block along with the tumor. Nerve is excised along with the tumor. You call it as radical parotidectomy, which is usually done for malignancy, right? So that ends our discussion regarding this salivary gland tumor. And as I said before, I will be discussing some review questions also, which we will be doing now. Okay, these are usually straightforward questions as far as the UPSC CMS and FMGE exams are concerned. Let us discuss that. WARTHIN'S tumor usually involves which salivary gland? It's a very straightforward question. It usually involves the parotid glands. Okay, right. The next one, in which of the following perineural invasion in head and neck cancers is most commonly seen? The question is very, very clear. Perineural invasion. So what should be the automatic answer? Perineural invasion is a feature and a very classical feature of adenoid cystic carcinoma, right? The next question, what is the surgery of choice for pleomorphic adenoma? Remember, pleomorphic adenoma is a benign tumor. So what would be the surgery of choice? Very important. It is just superficial parotidectomy. Remember, enucleation should be avoided in spite of it being a benign tumor. What is the reason I told you? Because of the presence of pseudopods. If you do enucleation pleomorphic adenoma, there is a high chance of recurrence because of this pseudopods, which are basically extensions from the pleomorphic adenoma. So remember, answer for this question is superficial parotidectomy only. Okay, right. Then the next question, the best diagnostic modality for a parotid swelling. I told you what is the best diagnostic modality? It is nothing other than FNAC, right? Okay. So I hope that this discussion was useful to you, and this is a question for you to comment upon. This was asked in one of the recently conducted UPSC CMS exams. So please see this question and comment your answers in the comment section below, and I would be very happy to know that. The question goes like this: a patient operated for parotid gland tumor develops symptoms of sweating and erythema or flushing over the region of cervical excision. This was noted while eating only, right? Now with this, probable diagnosis is what? I have given you 4 options. Just to do a little bit of reading on your own, and please comment your answers in the comment section below. Thanks for watching this video, and if you like it, please press the like button, and please subscribe to this channel so that you get notified about the new videos as and when they are posted to this channel. And please don't forget to share this with your friends also, so that they can get benefited. Okay, right. And you can join our Telegram channel for MCQ discussion, the link of which I have shared here, and it is also given in the description below the video. Okay, so thanks for watching, and I will very soon see you in the next video.